This video is on MesoBotox. MesoBotox has also been known as MicroBotox. Essentially what this is a technique to manage several things. Things that traditional Botox can't manage. You're actually using Botox to do it, but you're using it in a different fashion. It's very dilute, it is higher volume, and it's very superficial, what is known as intradermal, which means just the very superficial layer of the skin. The principal thing that I use Meso or MicroBotox for is to treat wrinkles of the mid-face, this area where people are smiling. If you think about it, you see people smile and they get these really deep wrinkles that go down the face, where in the past I couldn't treat that. Traditional Botox is safe around the eyes, safe around the forehead, between the eyes, and occasionally like for downturned lips or wrinkles around the mouth, safe as well. But at the higher concentration of normal Botox, which I just call Botox, it is not safe in here. In fact, I had a patient of mine whom I told her a million times, do not treat this area with normal Botox, we'll have a problem. Of course, she goes down to some other place and she gets treated here and she looked like a stroke victim for a few months. So very, very unsafe if you're not doing it right. And interestingly, I just put on social media about how I do MesoBotox, and I think a lot of the lay people out there don't understand the significant breakthrough this is, but I get about every few hours another private message from a colleague, how do you do it, Sam? What is the method you can improve these wrinkles? Because it's really hard to treat. So I have finally found a solution to manage these areas. So MesoBotox, again, principally is used to treat wrinkles of when you smile, it goes all the way down your face, which is very, very hard to treat normally. MicroBotox or MesoBotox has also been used for facial flushing, facial sweating, for pores, for texture. I'm not convinced that that will work extremely easily for that, although it is a derivative byproduct benefit. So in other words, if you get a little bonus that improves, great. But I'm not a big fan of trying to treat that because it's not necessarily reliable. In fact, years ago I was trying to do it for that single reason. I didn't get much benefit. What are the things you need to know about MesoBotox? First of all, the benefits are, as I alluded to, is really going to be the fact that you're going to have a significant, typically, reduction in wrinkles. What is a negative? The biggest negative you need to know is the fact that your smile can be slightly affected. Now, it's not like a stroke victim or anything. It's just that a lot of people don't even say that they are bothered by the smile, but they just feel like they can't have as much of the full excursion, and that's part of the reason why you're not getting that issue of the wrinkles coming down. So that's something you absolutely need to know, is that your smile will be slightly affected. If you say, well, I don't even want that, then don't do it. But the one benefit is that there is no other treatment for this. There's no laser that really manages it, no facelift, no fillers, no standard Botox can manage it. So this is the only method that I know currently of knowing how to do this. In addition, it lasts a long time. It oftentimes can last up to 6 months of treatment. And also, this is something that I have talked a lot about in normal Botox that people don't think about, is that normal Botox helps the texture tone of the wrinkled area to heal. So in other words, if you've done Botox repeatedly by quality injector over a few sessions, these wrinkles not only start to fade, but the results last longer and longer. So if you think about it, if this area doesn't create that deep crease every time you smile over a period of 6 months, and let's say you do this 2 or 3 times, then what can happen with the skin is that those corrugations don't get so deep over time. If you can't move it for a long enough time, your body will actually repair the damage. So this is a very exciting treatment that I have, pretty painless in the way that I do needle injections. There is a chance of bruising because there's a lot of little micro droplets, so you have to be off the medications that can cause bruising, and that's on my website under resources and then patient instructions, then medications to avoid. Of course, we can also hand one to you in the office. But this is a big breakthrough and to me it's probably one of the biggest breakthroughs of 2017. So this is something that hopefully will be a part of the practice for those patients that would benefit from it. And also one more thing is that if you're going to do a laser treatment on the face, it is not a bad idea to go ahead and do this if you have very deep wrinkles. And the reason for this is that it makes the skin heal better because the collagen is going to be smoother. In fact, I oftentimes routinely Botox my patients a couple weeks before laser, and this would be a great adjunct, especially if you've got these deep wrinkles, to let the laser work its best. So if you have more questions, obviously come in and talk to me. But I hope this short video on MesoBotox will help elucidate the benefits of this treatment and some of the limitations as well.